Hey there, animal lovers! Today we're diving into feline panleukopenia virus, or FPV. Don't let the big name scare you. We'll break it down so you can understand this serious but preventable disease. FPV is highly contagious and can make cats very sick. The good news is we can protect our feline friends through vaccination. Join me to learn how to recognize, treat, and prevent this disease. Early diagnosis of FPV is crucial for giving your furry friend the best chance of recovery. But how can vets tell if a cat has this sneaky virus? Well, it starts with a trip to the vet clinic. Your vet will ask you about your cat's history, including any recent illnesses, vaccinations, and potential exposure to other cats. They'll also give your cat a thorough physical examination, checking for things like fever, dehydration, swollen lymph nodes, and abdominal pain.
Next up, it's time for some detective work in the lab. Your vet may recommend blood tests to measure your cat's white blood cell count. FPV often causes a sharp drop in these important infection-fighting cells. They might also test your cat's feces to look for the virus itself.
Knowing the signs of FPV can be a lifesaver for your cat. Since this virus can quickly take a turn for the worse, it's crucial to contact your veterinarian immediately if you notice any of these symptoms.
Loss of appetite. If your usually food-motivated feline suddenly turns their nose up at their favorite treats, it's a red flag.
Lethargy and weakness FPV can really zap your cat's energy, leaving them feeling weak and uninterested in their usual playful antics.
Vomiting and diarrhea. These are common and often severe symptoms of FPV, and they can quickly lead to dehydration.
High fever. A high temperature is another telltale sign that your cat's body is battling an infection.
Keep in mind that kittens are particularly vulnerable to FPV and may show additional symptoms like wobbliness, difficulty walking, or even seizures. If you notice any of these signs, don't hesitate to seek veterinary attention right away.
The virus's sneaky attack. How panleukopenia affects your cat. So, how does this tiny virus cause so much trouble?
FPV is a master of disguise, sneaking into your cat's body through their mouth or nose. It can be spread through direct contact with an infected cat, or even indirectly through contaminated objects like food bowls, litter boxes, or even your clothing.
Once inside, FPV targets rapidly dividing cells, especially those in the bone marrow, intestines, and immune system. This attack on the bone marrow disrupts the production of white blood cells, leaving your cat vulnerable to secondary infections.
Meanwhile, the virus wreaks havoc on the lining of the intestines, causing severe vomiting and diarrhea. This combination of factors can lead to life-threatening dehydration, malnutrition, and a weakened immune system.
In severe cases, FPV can even damage the nervous system, causing neurological problems.
Understanding how the virus works helps us protect our feline companions. Fighting back treatment options for panleukopenia. While there's no magic cure for FPV, supportive care from your veterinarian can significantly increase your cat's chances of survival. The main goal of treatment is to keep your cat hydrated, provide nutritional support, and manage their symptoms. This often involves hospitalization and intensive care, including intravenous fluids. These help to combat dehydration caused by vomiting and diarrhea. Antibiotics. Since FPV weakens the immune system, antibiotics are essential to prevent secondary infections. Anti-nausea medication. These medications help to control vomiting and reduce discomfort. Nutritional support. If your cat is too weak to eat on their own, your vet may recommend a feeding tube to ensure they receive the nutrients they need. The road to recovery from FPV can be long and challenging, but with prompt and aggressive treatment, many cats can pull through. Supportive care is crucial for cats battling panleukopenia.
Shielding your feline friend, preventing panleukopenia. The good news is that FPV is preventable.
Vaccination is the cornerstone of protection. Kittens receive their first FPV vaccine as part of their initial shots.
Adult cats need booster vaccinations. Here are some other ways to keep your cat safe.
Limit exposure to potentially infected cats.
Practice good hygiene.
Isolate infected cats.
Vaccination is the best protection.
Protecting our furry companions. The importance of vaccination and early intervention. As we've learned today, FPV is a serious threat to cats, but it's a threat we can combat with knowledge and proactive care. By understanding the virus, recognizing its symptoms, and seeking prompt veterinary attention, we can give our feline friends the best possible chance of survival. Remember, prevention is always better than cure. Vaccination is the most effective way to protect your cat from FPV, so make sure your furry companion is up to date on their shots. By working together, we can keep our cats safe from this preventable disease and ensure they live long, healthy, and happy lives. Let's keep our feline companions safe and healthy.